Moving on to what causes breast cancer. Again, it's the same mutation. A mutation happening in the breast tissue, if it is not controlled by your immune system, will start to grow into a cancer. 5 to 10% of breast cancers, however, happen due to family history. This is where in the family there is more than 1 or 2 female members diagnosed with breast cancer or other cancers related to females like uterine cancer or cancer of the ovary. This is where the mutation, the change in the gene in the cell is passed on between generations. You could get the mutation from your grandmother who has been affected with breast cancer, or your mother or your dad's sisters or mom's sisters, etc. But only 5 to 10% of breast cancers are due to a family history. The rest 90 to 95% happen due to a mutation which is happening within yourself. And we know women who have not been pregnant or who have not done much breastfeeding and women who are obese are at increased risk of mutations in the breast and hence at increased risk of breast cancer. Talking about symptoms of breast cancer, how do you know you have breast cancer? If any woman is at risk of breast cancer, then we need to know how do we find out. What can we do to find out if you have breast cancer? Well, the predominant symptoms of breast cancer are breast pain. Saying that, a lot of women get breast pain, especially before menstrual cycles. So every woman with breast pain doesn't need to start to panic that is this breast cancer. The usual trick we tell our patients is if you get pain in both your breasts, it cannot be breast cancer, because breast cancer almost never happens to both breasts at the same time. Developing pain in your breasts, especially before your menstrual period, is a very common phenomenon. It happens due to your breast tissue getting stimulated to hormone surge, which happens before your periods. However, if you suddenly start to develop pain in one or the other breast, which you have not had before, and this pain is not going away even after you have had a menstrual period, or the pain has been persisting for at least 2 to 3 weeks, or you start to feel a lump in your breast, a growth, a hard feeling, a firm feeling in your breast, and again you don't remember feeling this before, or this feeling doesn't go away after 2 to 3 weeks, or suddenly you feel like your nipple, which normally is protruding, is starting to go back in, what we call retraction of the nipple. Any changes in the skin on your breast or on your nipple, like a hard area or like a thickening or like few spots on the skin of the breast, redness on the skin, any discharge from the nipple, or any swelling in your armpits. These are usually the signs of breast cancer. A lot of women do get breast pain and feel lumpy in their breasts before periods, so please do not panic if you get these symptoms, but do visit a doctor. And if you go back to the symptoms I was mentioning, you know, the pain, the swelling, the redness, discharge from the nipple, how would you find out you have these symptoms if you never examined yourself? So the basic concept is please keep examining your breasts, look at your breasts at least once a month, preferably after your menstrual period. Go stand in front of a mirror, raise your arms, press against the mirror, lean forwards and see what your breasts look like. Do they fall forwards? Is there something in the breast that is pulling your breast back? These are all early signs of breast cancer. See the color, the shape and the size. Most women have one breast bigger than the other. Then look for any skin changes. The next thing we ask you to do is examine yourself. Do it when you're in the shower, when there is water and soap in the body and it becomes easy. Or if you're somebody with large breasts, do it when you're lying down. Have a pillow under your shoulders, lift yourself up a bit and straighten your hand and examine yourself with the palm of your hand, not with your fingertips. And we advise you to examine your left breast with the right hand and vice versa. There are plenty of YouTube videos which very clearly take you through a breast examination, and I would highly recommend you do that. We advise every woman who is 20 years and older to examine herself once a month. And only if you did this, you will know any change which hasn't been there before. And if this change has persisted for more than 2 weeks, then please do come and see us. When any woman comes to us with breast symptoms or a fear that she might have breast cancer, the first thing we do is obviously take a history, take a family history, see if you have any risk factors such as obesity or not breastfeeding and etc. This doesn't mean you are at risk of breast cancer or you're not, because perfectly healthy woman who has had 6 children and breastfed for 15 long years can also get breast cancer, so nobody is an exempt. The next thing we do is the doctor examines you carefully and thoroughly, either in sitting posture or in lying down posture. And then, depending on your age, we send you for either an ultrasonogram of your breasts, what we call a sonomammogram, or a mammogram. The difference between a sonomammogram and a mammogram is a sonomammogram is where an ultrasound scan is being carried out on your breast. This is very similar to the ultrasound scan you can have on your tummy, for example, when you're pregnant. Ultrasonogram is safe, there is no radiation, and it doesn't harm your body in any way. So you can have as many sonograms as you might need, but it doesn't hurt you in any way. On the other hand, mammogram is a test where we pass X-rays into your breast. So an X-ray plate goes under your breast, another goes on top of your breast, and your breast gets squeezed in the process. So it can be ever so slightly uncomfortable, and it takes 2 to 5 minutes, and it gives us a very clear picture of the inside of your breast. On mammograms, it is possible to pick up a cancer which is no more than the size of a rice grain. So a mammogram is a fantastic test, but it allows radiation to go into your breast tissue. And if the person who is taking the mammogram is not careful, then some of the radiation can also go into your thyroid gland or into your lungs. So every time you go for a mammogram, please check with the radiographer and make sure you have a thyroid shield. Otherwise, you're damaging your thyroid tissue in the process. Because mammogram has radiation, we advise women aged between 45 to 65 to have a mammogram once every year. This is the advice from American Cancer Guidelines Network. In some people where the risk seems small, we might even suggest to alternate mammogram 1 year with a sonomammogram the next year, so you're not exposing yourself to a lot of radiation. The other thing we do if we are highly suspicious you have a cancer, say I see a change in your breast, a lump, there is a discharge from your nipple, or I see skin thickening, is I might want to take some tissue, some fluid, or actually a sample of the tissue from the abnormality, what we call an FNAC or a core biopsy. That will help us diagnose if you have a cancer or if you do not have a cancer.